Do you ever feel like you're not getting the results you expect from your skincare regimen? Here are some reasons why your products might not be working for you. Hey there, I'm Dr. Sam Ellis, and I'm a board-certified medical and cosmetic dermatologist in Northern California. I'm here to help you understand your skin and find products that work for you. So if that sounds good, give this video a thumbs up and don't forget to subscribe to the channel. It's not uncommon to be tackling one or even a few different skin issues with our skincare regimen and then to be underwhelmed with the results that we're getting, or to feel like the regimen we've put together isn't really living up to the expectations that we had for it. And so I wanted to go through some reasons why your skin products may not be working for you. Number one, you have not been using your skin product long enough to see results. I hope no one takes offense to this because I absolutely fall into this category of people as well, who, when they make a lifestyle intervention, whether that's a new diet or an exercise regimen or bringing a new product into their skincare, that they get impatient and they want to see results pretty much immediately. And I think all of us know in our heart of hearts that immediate results should not really be the expectation when it comes to skincare interventions. But I think all of us also wake up the next day after introducing a new product, looking in the mirror like, did it do the thing I want it to do? And this is probably not helped by the fact that in skincare advertising, so many times we hear people say, I woke up the next morning and my skin was transformed, or only after using this for 3 nights, I saw a huge difference in my skin. And that's amazing when that happens for someone, but that generally should not be the expectation. And here's why. Our skin is made up of multiple layers of skin cells stacked on top of one another. And over the course of about 28 days, the most bottom layer of skin cells works its way up to the surface and then exfoliates off. And 28 days is just an estimate. It varies based on how old you are. And when you introduce a skincare item that is meant to address something deeper down in the tissues, like acne or irregular pigmentation, it takes a couple of full skin cycles, so 28 days and then 28 days again, and maybe even a third time, for those results to become visible on the skin's surface. Especially with active ingredients, we are fundamentally changing something about the skin or the skin's environment, and then we have to wait for the skin to respond to that change. So for example, if you use benzoyl peroxide to treat acne, benzoyl peroxide, one of its main functions is to reduce acne-causing bacteria on the skin. So you have to wait for the benzoyl peroxide to wipe out the bacteria, which happens pretty immediately, but then you have to wait for the skin to respond to that change, and that's what takes time. Now, there are certainly products that you can tell immediately if they're working for you or not. So for example, cleansers. If you are washing your face to remove your makeup or just the general debris that has accumulated on your skin over the course of the day, you can tell pretty much in a single wash if that worked for you, because if you go to dry your face off afterward and you have residual mascara and foundation on your towel, you know that it didn't cleanse in the way you're expecting it to. This might be why cleansers are some of my favorite types of products to try out, because I can tell pretty immediately within a few washes if I like how it cleanses my skin and I like how my skin looks and feels afterward. The same really goes for moisturizers. If you're just looking for the skin to look and feel plumped and to feel hydrated and not tight, usually within a few applications, you can get a sense of whether or not that moisturizer is doing its job. Now, the caveat with this would be if you are introducing a moisturizer to help repair your skin barrier. That takes a few skin cycles, and that means that you need to use that moisturizer regularly for a month or two before you can really understand, is this moisturizer doing what it's supposed to? Something that's becoming more common is products not just serving their primary role, for example, a cleanser just being used to wash the skin or a moisturizer just being used to moisturize the skin, but they have other actives contained within them that offer more long-term benefits for the skin. So this would be a cleanser that has something like salicylic acid or glycolic acid in it, or a moisturizer that also has growth factors or peptides in it. And because those active ingredients take time to exert their influence on the skin, the added benefits that those should offer should be expected to be seen at around 3 months. And I find that 3 months or 12 weeks is a really good benchmark to look at your skin after you've made an intervention to truly understand, is this working for you? You might not be at your final result, but you should be able to tell at the 3-month mark if things are improving. A lot of dermatologists like this 12-week or 3-month mark, and for good reason. At that point in time, your skin has gone through a minimum of 2 full skin cell cycles to sort of regenerate itself, and also a ton of clinical trials when looking at the efficacy of certain skincare ingredients use the 12-week benchmark. So that's the case usually for hydroquinone, for tretinoin and other retinoids, and for alpha and beta hydroxy acids. And when looking at the improvement of acne with a topical acne regimen, the 12-week mark is usually what we use as our timeline. And I cannot tell you how many patients come in at their 3-month follow-up for their acne and say, Dr. Ellis, I was really discouraged. For the first 2 months, I saw no improvement, or I even felt like my acne was getting worse. And then I hit 10 weeks and it's been smooth sailing ever since. So it's really important to give your products their full time to truly work and demonstrate their benefits before you decide that it's not working for you. And I know how hard this is, because when you decide you want to see an improvement, 3 months is a really long time. But in terms of skin and the skin's timeline, 3 months is relatively short. And the final comment I will make on this has to do with topical retinoids. If you are using them for their anti-aging benefits to help with fine lines and wrinkles and pigmentation, you might not see improvements even at the 3-month mark. Although most people will see some type of small change, we're looking for use after 6 months, after a year, after 5 years, after 10 years. It's really very, very consistent, prolonged use with retinoids that gives us the ultimate ideal benefit. And speaking of consistent use, that brings me to point number 2 of why your products might not be working for you. And that's because you're not using them consistently. This doesn't necessarily mean that you need to be using a product every single day, but you need to be using it regularly to see its greatest benefit. And I see this all the time happen in my acne patients, not to harp on my acne patients, but it's just one of those things where it's very obvious whether or not the product is working. And what they'll do is they'll use their products until their acne is gone, and then they'll stop, and then their acne will come back and they will restart that regimen. And really, if they want to keep their skin clear, the goal is to use it consistently over time, even when their acne is better, to keep their acne well managed and well cared for over time. I'll also see this a lot with the use of topical retinoids for treatment of anti-aging or premature skin aging, where someone will use their retinoid a couple times a week, here and there. They might stop because their skin got irritated, and then they'll pick it back up a month later, and they'll use it every other day for a little bit. That kind of inconsistent use, it doesn't mean you're not going to see any improvement, but you might not see the optimal improvement. When we do clinical trials, for example, on retinoids, those patients are using their retinoid every single day. And when they use it every single day, we can expect X outcome. So now if you're using your retinoid every 3rd day or every 5th day, it's not to say you won't see some improvement, but you're not using it how the product is intended to be used. So you might not see the full benefits that it can offer. Now, some of you might be watching this and going, I would love to be more consistent with my retinoid or with my acids, but my skin just can't tolerate it. It gets way too irritated. This is a great time to collaborate with your dermatologist or your esthetician and really strategize about how you can incorporate products into your regimen in a way that helps you use them more consistently. And sometimes that means changing out a product or picking something with a lower concentration of active ingredients so that you can use it more consistently. I would much rather my patients use something that's not as quote unquote strong more regularly than sporadically incorporate something really powerful into their routine. So if you're using a product and you're thinking it's not working for you, 1, make sure you've been using it long enough to really see the benefits. 2, make sure you've been using it consistently enough to see the benefits. And then the third thing, a big reason why I find people's products are not working for them is they're just not using it correctly. Now, of course, part of using a product correctly is using it consistently, how it's intended to be used, but also not using it as a spot treatment. So a lot of times I see people using their prescribed acne medications as spot treatment. There's really no acne prescription that should be used that way unless your dermatologist has instructed you to do so. Acne treatments should be done over the entire face, more as a preventative measure for future acne than to treat the active pimples that you see in that moment. Sometimes people are using too much of their product, and so they're getting excessive irritation that could be avoided by using a smaller amount. This is why when I'm counseling my teenagers or even my adult patients on how to apply their acne medications or their other medications, I actually show them what they should be using so they have a real understanding of what's an appropriate amount of medication for whatever area on their body that they're trying to cover. Other ways you might be using a product incorrectly are layering it on top of something when really it should be put under a certain product, or combining it with something that it shouldn't be combined with because it causes excessive irritation or even deactivates that product. These are all things worth considering, and I don't expect every person to know the answer to how to layer their medications or how to use every single skincare product and combine combine it with the other products that they're using. But again, this is where professionals can really help you with that. That also brings me to my next point of why your skincare might not be working for you, and that's using too many products. My skincare philosophy is all about intentional skincare, choosing products to specifically target exactly what you need to target and not including things just because you think you should be using them. Even if you have a really intentional routine, you're going, okay, I have acne, so I want something in my routine to help with that. I have melasma, so I want something in my routine to help with that. Ooh, and I want to do anti-aging, so I want something in my routine to help with that. Even if you've picked your products based on that, that can overwhelm the skin. And as much scientific evidence as we have about various ingredients and various products, we do not have that much data about how these products interact with one another. Is one preventing the absorption of the other? Is one deactivating another one? Are you getting excessive irritation because you're incorporating all of these things? And so what I counsel my patients on, and this is sort of my own philosophy when treating my own skin as well, is picking the thing that bugs me the most. So for example, melasma, and really targeting my routine towards that with just a few products. And then once that skin issue, my main skin issue, is under control, then pivoting my routine towards my next skincare goal, which might be long-term anti-aging. I see this all the time with my acne patients who are trying to incorporate vitamin C into their regimen. For a lot of patients, vitamin C is excessively irritating, or it can lead to breakouts. And my poor acne patients are like, oh, I want to be using vitamin C for its anti-aging and protective benefits, but I keep breaking out because of it. And what I tell them is, let's not focus on vitamin C. That's a great ingredient, but it's kind of the cherry on top of an anti-aging regimen. Let's first get your acne under control using the fewest things possible that we can to have an effective regimen. And once your acne is optimized, then we can go in and add the vitamin C or add some other ingredient that you're excited to try. Skincare really is a marathon, not a sprint. And although we want to see immediate, exciting results, it's really the long-term benefits of being consistent with our skincare, from picking products that are intentional, that are really going to get us to a place where our skin is healthy all the time. All right, moving on. Another reason why your skincare might not be working for you is because you're not adjusting your skincare regimen for when your skin changes. And what I mean by that is our skin is a living organ. It is changing throughout all phases and stages of our life. So for example, if we have a big hormone shift when we get pregnant, our skin might change in turn with that. Or if we move to another part of the country and we were living in a very dry climate and now we live in a very humid climate, our skin will respond differently to the new environment that we are in, and we need to adjust our skincare regimens to respect that. So if you feel like your skincare products aren't working for you anymore, take a step back and just kind of look at what your skin is doing and see if your baseline skin has sort of changed from what you are used to. If you used to have really oily skin as a teenager, so you used a really lightweight moisturizer, and you're finding now as an adult that your skin is a lot more dry, you might need to pick up a new product or change the thickness or the consistency of the products you're using to reflect the current state that your skin is in. Another reason your skincare might not be working for you is you may be using the wrong products for the skin condition that you're trying to address. I see this all the time with people trying to use retinol that they get at the drugstore or online to treat acne. So although some retinoids are proven to help with acne, like tretinoin or adapalene, which you can get over the counter, retinol has not really been shown to be very helpful with acne. And so when I see a patient not getting better on it, I know it's because they probably don't realize that they're using the wrong thing within the retinoid category. Another reason your skincare might not be working is because your expectations are too high, or in that case, maybe it is working, but it's not working as much as you'd want it to. Skincare can certainly reduce or minimize certain skin symptoms or issues that you're dealing with, but it might not take them away completely. So for example, a lot of patients think that when they're on an acne regimen that they will never get a single pimple ever again. And that's great if that happens. But really the goal with that kind of treatment is to reduce the amount of flaring or reduce the number of lesions that you're dealing with every single month. But if the expectation is complete clearance of your skin issue, you're likely to be disappointed. I feel like this issue comes up all the time when people are talking about the efficacy of their eye cream. Eye cream can be great for moisturizing the skin around your eye and maybe plumping out some fine lines and wrinkles, but it's not going to structurally change the anatomy of your eye. It's not going to be the same as having upper or lower eyelid surgery. And as long as you understand that, you're unlikely to be disappointed. I find that, especially when it comes to anti-aging skincare, it's more there for optimization, for maintenance, but it's not going to take 10 or 20 years off of your skin. And then my final reason why your skincare might not be working for you, and I think this one is so important, is that products are not the solution to all skin problems. And this is really where a dermatologist can come in and help guide you. So many times I see patients in my office for a brown spot on their face and they're going, oh my gosh, I've tried hydroquinone. I have used every single lightening and brightening skincare option out there for years. And then it's me who has to tell them, oh, this is a skin cancer. That's why it's not going away. Or this is a growth. A lot of brown spots are actually very thin growths, and those types of growths and brown spots are not responsive to skincare. They need to be removed with a laser or a chemical peel or some other destructive method. And I feel like sometimes patients have wasted so much time and effort investing in their skincare when in reality, that was never going to help them. Another skin issue where this comes up a lot is dilated capillaries or visible red blood vessels on the cheeks. That is an anatomical or structural issue, and you need a laser or some other energy-based device to destroy those superficial vessels. There's no cream in the world that's going to get rid of those for you. And then lastly, although skincare has come a very long way and there's so many amazing innovations that continue to come to the forefront and be available for people, sometimes you need prescription medication, and that's okay. And again, that is where a dermatologist can come in and guide you and help you get the results that you're seeking, no matter what the proper intervention may be. Okay, that is my 2 cents on why your skincare may not be working for you. Were any of these tips helpful? Please tell me in the comments. Again, thank you for watching and being here. I so appreciate your support of this channel. So if you like this video and subscribe, that would be amazing. I will see you next time.